And you're welcome back to The Pulse with me, Blessed Suga. Now, the Ghana AIDS Commission has debunked speculations that there are over 50,000 children living with HIV in the country. In a write-up making rounds online, the Daily Searchlight attributed the figure to the HIV ambassador, Azuma Nelson. But clarifying figures, Director General of the Ghana AIDS Commission says data available shows about 28,000 children are living with the virus. Mr. Treme joins us now on Zoom with further details on this. Thank you very much, sir, for your time. So help us understand the figures if it's a bit exaggerated out there. What's the level of infection amongst young people in this country?
Well, thank you very much, Blessed, for having me. The figure quoted for children aged 14 and younger obviously is in error. The correct figure is what you mentioned, which is 28,710, representing 8% of the total number of persons living with HIV in Ghana as at the end of 2020. We're currently compiling data for 2021, so this figure is actually the most recent data that we have. And so there couldn't be any other data. And therefore, the correct figure is 28,710.
And if you look on your screens right now, you can see a breakdown of the figures there. But regardless, these are worrying figures, isn't it?
Oh, yes. These are children below 14 years and below who got infected through mother-to-child transmission. And in this day and age, we do not expect that we should have such a high number of children getting infected, because we have the prevention of mother-to-child transmission, in place, where we usually there is medication for preventing vertical transmission, and so we should not be seeing this large number of children being infected. And in fact, it is one of the things that as a commission, together with our stakeholders, the Ministry of Health, Ghana Health Service, and all the stakeholders, including our partners, think that it has to change as quickly as possible. It has to change because it is highly possible for us to have babies who are free of HIV. And we've got the technology and we've got the capacity as a country to achieve that. The challenge we are having is mainly because of inadequate equipment to test the children at the right time to know their HIV status and be able to provide them the necessary treatment that would save their lives and also ensure that they grow up to become, adults and contribute to the development of this country. And so in our strategy, 2021 to 2025, we seek to eliminate mother-to-child transmission. And it is not only for HIV, we are also seeking to eliminate mother-to-child transmission of syphilis and hepatitis B. And we call it triple elimination. And we have our partners behind this commitment, and government will really want to see that by the end of 2025, we would have achieved elimination of mother-to-child transmission. And so we believe that every woman, especially pregnant women, will avail themselves of the services that we have in place at health facilities to ensure that they get tested. And if they test negative, they continue to do the things that would protect them from infection. But if they test positive, then they have to accept the offer of treatment, which is free for every person living with HIV in the country. And with the treatment, they will be able to prevent mother-to-child transmission. And the doctors and nurses are well trained to handle any such case to ensure that no child is born with HIV. And as I'm speaking to you, mothers who cooperated with doctors, the health facilities, and adhered to treatment and followed the prevention of mother-to-child transmission procedures have had babies who are HIV-free, and we have several thousands of such babies in this country.
Okay.
And so it's very possible for every mother to have a mother who lives with HIV to have an HIV negative test.
I get the dynamics of this. Meanwhile, President Akufo-Addo is also worried about the figures. Listen to him address the media at a press conference last year on this matter.
As rightly pointed out by the UNAIDS, the Joint United Nations Program on HIV/AIDS, and I quote, "Today, the world is off track from delivering on the shared commitment to end AIDS by 2030, not because of a lack of knowledge or tools to beat AIDS, but because of structural inequalities that obstruct proven solutions to HIV prevention and treatment," unquote. Gender inequality is a major reason for the disproportionate disease burden on women and girls. 2 out of 3 Ghanaians living with HIV are women, whilst 4 out of 5 new infections in young people aged 15 to 24 years are adolescent girls and young women. It is extremely troubling that adolescent girls and young women account for 28% of total HIV new infections in the country. For us to end AIDS, we must eliminate inequalities and discrimination in every form of its manifestation, such as domestic and gender-based violence, harmful, outmoded traditional practices like widowhood rights and child marriage.
So that's President Akufo-Addo there. Mr. Chirime Tiahini is the Director General of the Ghana AIDS Commission. He's not gone. He's still here with us. So that's the concern of the President. Beyond that, we know that the greatest fear out there is that we keep losing more and more people to this dreaded disease. The trend we're seeing from 2019 and 2020 indicates that it appears the figures are receding. What's accounting for that? And are we still on that tangent where we are seeing a decline in the number of persons we're losing to this disease?
Yes, the trajectory is clearly showing that we are on a declining trend so far as new infections of HIV and AIDS-related deaths are concerned. Between 2019 and 2020 alone, the decline was the AIDS deaths declined by 19% in just 1 year. And I think for new infections, it declined by 10%, which is quite significant. Although we want to see a much higher decline. And so we all have to reckon of AIDS. In fact, no one should develop AIDS and never mind dying of it. And so it's all because of the antiretroviral treatment, which is tested and proven to be the only effective treatment so far, to date, for persons living with HIV. And so everybody who lives with HIV has to adhere to treatment. But unfortunately, we have more than 100,000 persons living with HIV in Ghana who are not on treatment. And that is the reason for the high numbers of death relating to AIDS. And so it shouldn't happen, because those who are on treatment and adhere to treatment do not die of AIDS-related causes. Of course, if they have to die, it may be some other disease, but not AIDS-related causes. And unless, of course, there is some situation that has not been seen by or investigated by health personnel. And so we encourage every person who lives with HIV to be on treatment. It doesn't matter how you feel. Some of them think that they are strong and don't feel sick, and so they don't need treatment. But the truth of the matter is that you need treatment even when treatment works better for you when you are strong and healthy, when you don't feel sick, because that ensures good health outcome so far as treatment is concerned. And so we encourage every person living with HIV to be on treatment. Some of them also, after having been on treatment for some time, especially when their viral load becomes suppressed, they think that they are well enough not to be on antiretroviral treatment. And that also creates a lot of problems for them, because within a short time after stopping taking the medicines, the viruses would erupt from the tissues where they've been hiding, and then they begin to attack the immune system once more. And if you do not continue treatment, then obviously you are going to develop AIDS. And so these are some of the few challenges that we have. And we believe that all Ghanaians, especially those living with HIV, will agree with us and cooperate with the healthcare workers and adhere to treatment so that they get the full benefit of treatment.
Right. The Ghana AIDS Commission was reporting in the media late last year that you were raising concerns with how the growing trend of older men intentionally infecting younger girls. Has that trend changed since the beginning of this year?
Thank you for asking this question. I just have to indicate to you that that was a misreporting. That is not what was said. But as for older men having sexual activities with girls or younger women or young women is known to us, and it is well documented in the literature. When you look at the demographic and health survey and the multi-cluster indicator surveys, you see that age mixing, we call it age mixing, so far as sexual activities are concerned, is quite prevalent in the country. But we will not necessarily attribute HIV infections among adolescent girls and young women to only age mixing. There are several other factors. And so I guess thanks for the opportunity to correct that misreporting.
So how then do we describe the situation? What's the appropriate description to give to that?
Well, the fact is, adolescent girls and young women are becoming infected. I mean, based on the figures President well articulated, which you played to our hearing of you a moment ago. It's a reality that we have to address because it's not the best. for the young women to be infected. It is men who infect them anyway. And so it could be from their age groups, but when you look at the data, it's quite clear that it's coming from older generation than their own age group. And so older men will have to protect the young women if they have to have any affairs with them. Ideally, we expect that young adolescent girls would abstain from sex because they are within the age period when they should prepare themselves for the world of work, and therefore their focus and concentration should be on either educating themselves by going to school or learning a trade so that they can, reach their full potential. And so that should be their concentration. But if they cannot, then they have to use condoms at all times, making sure that anytime they use condoms they use it correctly. But for men, it is very necessary that they protect themselves and protect their partners, because you don't know who has HIV. You cannot see it, from the face unless you test. And most often people do not know their HIV status, especially of their partners. And if you have unprotected sex, and if it, unfortunately, your sexual partner is HIV positive, we pray that you don't get it, but there is high possibility that you will get it.
Chairman Tuahini, I'm grateful for your time here on The Pulse.